Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 6 homeopathic remedies for post-traumatic stress disorder (PTSD). We will use this PTSD name throughout the video. What is post-traumatic stress disorder? Let us analyze the name. Post means after, traumatic means generated from injury, stress means extra pressure on mind, and disorder means illness. Joining all, we get illness generated from extra pressure on mind after some injury. Of course, this injury is mainly on the mental sphere. Thus, there must be some scary or tormenting or shocking injury event, that is called injury, behind, which the subject is unable to efface from his mind because it leaves behind a mark in the cognitive sphere of the subject, who is ailing from the mark time to time even after the event. Let us take a live example. Mr. X uses to return home drunken from workplace at night and beat his wife very often for trifles. Their only child, a boy aged about 7 years, generally remained in sleep during the period. One day suddenly the boy woke up hearing its mother's cry in agony. It opened the door ajar and noted that father had been flogging mother with a belt. The boy started to tremble in fear and fell down there unconsciously. What events can create PTSD? Natural disaster, act of terrorism, sexual assault, war, demise of a most dear one. Virtually any word ghastly event or prolonged harassment and hopelessness can create a PTSD. But a particular event cannot create PTSD in the minds of all onlookers because the state of recipient minds is also a factor. If mind can sustain the instant impact of the event, subjects either fight against the situation or they flight. It's a very popular term used in psychology, fight or flight, from the scene. However, those who fail to sustain moment's impact may lose their consciousness and possibly get rid of future problems of PTSD. All who experience a horrible event, even from terror during its occurrence, but not all would experience PTSD. Those whose minds could not efface the terror would suffer from PTSD. But many of them might remember the event but forget its impact. They won't suffer from PTSD. PTSD may create from prolonged harassment, sense of insecurity over a long period, or want of help at the time of need despite every possible attempt. In this situation, there is no ghastly untoward event is there, but long impact of painful experience gives rise to PTSD. What are the signs symptoms of PTSD? Symptoms may begin early, say within 3 months of the traumatic event. Again, it may start years after the traumatic experience or event. Symptoms must last more than a month and be deep enough to interfere with the relationship or daily work of the subject before the same can be said to link to PTSD. That is a definition. You cannot call all this type of experiences PTSD. This is the condition. Symptom must last more than a month and be deep enough to interfere with the relationship or daily work of the subject suffering from this PTSD before the same can be said to link to PTSD. The course of the illness varies. A few may recover within 5 to 6 months, while in another chunk of unfortunates, it may last longer, and finally there are also few who suffer chronically without any sign of complete recovery. They are problematic patients. A person must suffer from all of the following for at least 1 month in order to be diagnosed as a subject of PTSD. Specific and critical criteria that if one suffer from this, at least one of these, so he is suffering PTSD. Number 1, at least one re-experiencing symptom, at least one avoidance symptom, at least 2 arousal and reactivity symptoms, at least 2 cognition and mood symptoms. This will be cleared in the next step. Re-experiencing symptom of PTSD. Re-experiencing symptoms of PTSD, thought of the old event reappears over and over in mind as if those are happening in front of eyes of the subject. Heartbeats increase, sweat floods all over the body, mouth gets dried. Any sound, sight, person related to the event may act as trigger. For example, if event was subject getting drowned in water, if the event was subject getting drowned in the water, the same flare up in his mind seeing someone drowning in a movie. In a movie. Avoidance symptoms. Staying away from the event, situation, objects that are reminder of the fact. As for example, had it been an event of falling from a high-rise building, subject avoids to enter into such building. Arousal of reactivity symptom of PTSD. Being easily startled, outburst of emotion, sleep disturbance, getting tense, etc. These are not related to traumatic event, rather expressive of internal instability. Nonetheless, these interfere with daily activities of the subject. Cognition and mood symptoms of PTSD. Loss of interest in enjoyable activities, feeling of guilt and blaming self, negative thought about self and others. These alienate the subject from others in the family and society. Exclusion of substance abuse, medical illness must be made in order to link these to PTSD. That is, you can link only the problem linked to cognition and mood symptom if these are not there. That is, there is no history of substance abuse or medical illness. Yet, the loss of interest in enjoyable activities, feeling of guilt, blaming self, negative thought about self and others, and the subject is alienated from others in the family. So there must be something behind. That is PTSD. How do children react to PTSD? Older children or teens may react like adults. They also may show disruptive, disrespectful or destructive and revengeful behavior. However, children of lower age may wet their beds despite learning toilet training, may forget how to talk or just unable to talk, become unusually clung to one parent or other adult. What are the risk factors of PTSD? Anyone can develop PTSD at any age. This includes war veterans, children and adults who have through physical or mental or sexual assault, abuse, disaster, accidents, devastating events. Women suffer more in PTSD compared to men. About 8 out of every 100 persons experience PTSD at some point of time in their lives. Gene plays a significant role in PTSD. Subjects who have received childhood trauma, that is, these persons are also can be affected with PTSD. Persons facing horror, helplessness, long harassment, hopelessness, extreme fear and rejection. Person received little or no social support after the event. Person having a history of substance abuse or mental illness. Person having tubercular diathesis or scrofulosis. Star. That is, this symptom you cannot get in any book of psychology. This is from homeopathic angle. Since I am a homeopathic chronic practitioner, I know this type of PTSD can be affected easily with person having tubercular diathesis or scrofulosis. So I have added this. This is not available in any book of psychology. What are resilience factor of PTSD? Resilience is a psychological factor which determines individual response to adverse life events. There are 5 pillars of resilience. Resilience means how much you can take and you can fight or absorb without showing any symptom. Number 1, self-awareness. Number 2, self-care. Number 3, mindfulness. Number 4, positive relationship. Number 5, purpose. Resilience factors of PTSD are seeking out support from other people like friend, family, finding a support group, learning to feel good as to one's own action against the event, having a positive attitude to learn from the worst experience, being able to act and respond to the situation, getting homeopathic constitutional treatment to eradicate genetic dyscrasia. Again, the last line you cannot get in any book of psychology. As a homeopathic chronic disease practitioner, I have added this and I have repeatedly noted this to be a fact. How to manage a case of PTSD? A case of PTSD is managed by the following ways. Number 1, remedial treatment. It is discussed later. Number 2, psychotherapy, provided by an expert psychologist or psychiatrist. There are different types of psychotherapy for PTSD cases. Some target the PTSD symptom directly, others concentrate on the social, familial or job related problems. Aim of psychotherapy is to impart skill to the subject on how to know the triggers, how to manage symptoms, how to develop resilience. There is resistance against PTSD. One effective form of therapy is cognitive behavioral therapy, CBT. Two particular therapies, namely exposure therapy and cognitive restructuring, deserve discussion. These two are relevant to CBT. Number 1, exposure therapy. Here the therapist, with the help of drawing, imaging, writing, visiting the place of occurrence, gradually expose the subjects to the trauma they experienced and dilute the element of fear, very often imaginary or exaggerated. That is very often, it may so happen actually, the subject take the event in different way. In different way, he has exaggerated the situation, and he imagined a lot of things which is not actually so. So here psychologist intention is to make him know this fact that you have exaggerated, your problem is imaginary, there is no such event behind, so that the person comes out of the problem. Number B, cognitive restructuring. It is noted subjects remember the events differently and think themselves guilty. Here the subjects think themselves guilty. The therapist make them understand the sequence of the real event so that they feel that they are not to blame for the event, because this guilty feeling is also imaginary or standing on a wrongful thinking. So the psychologist's duty to show, to prove, to place facts before him so that they can feel that they are not to blame for the event and thereby feel relaxed. Both the things are very much effective. Direct exposure to therapy, direct exposure to event, and cognitive restructuring. Now we will take up remedial treatment. In modern allopathic systems, antipsychotic and antidepressants are used. However, in homeopathy, remedy is chosen on the basis of totality of symptom basis. Stana mate for PTSD. Very sensitive as to what others say about her. Anxious, sad, discouraged, nervous. Words from before menses. Cannot get rid of an idea once fixed in mind. Taciturn. Dislikes society. Sudden fits of passion. Forgetful, absent-mindedness. Hopeless, despondent. Feels like crying all the time, but crying worsens the situation. Staphysagria and PTSD. Violent outburst of passion. Always angry, gloomy and petulant. Child cries for many things but refuses them when offered. Very sensitive to others' remark about him, her. Sadness with irritability. Very forgetful. Even fear from his own shadow. Very fearful, even fear from his own shadow. Abrotinum for PTSD, a predefined remedy for children suffering from PTSD. They are disposed to some cruel, inhuman act like detaching fins of butterflies, grasshoppers. Disease tends to metastasize. That is, one disorder gone, new trouble appears, like diarrhea subsides, mental abnormality appears, or the PTSD also may alternate with some physical symptom also. Sepia for PTSD: angry, irritable, easily offended, wants to commit suicide, shy, says and does strange things, nobody knows what she will do next, aversion to family or whom she loves most. Irritability alternates with indifference or sulkiness, worries constantly over imaginary troubles, takes pleasure in teasing others, aversion to company yet dreads to be alone, breaks down in spell of weeping. Tuberculinum from PTSD. Children suffering from PTSD awake screaming with restlessness, fears animals, especially dog, maybe cats also, does not want to remain in a particular place long, changes place very often, wins, complaints for travel. Symptoms constantly changing. Begin suddenly, cease suddenly. Patient takes cold easily, susceptible to change in weather. Desire to use foul language, curse, swear, loquacious. Contradictory state exist side by side, such as insomnia against stupor. Shall PTSD. Children obstinate with sensitive weeping mood, cry when spoken to kindly. Construction, sorry, compunction of conscience, that is, bite of conscience, about trifles, guilty feeling, startled from least noise, screaming violently, disgust for life, wishes to drown herself. With this, the video ends. Thanks for listening and viewing. If you got any problem, please write down in the comment section. I will certainly reply.